Between us, who do you think the child listens to more?
I don't think you should put up these questions.
I win. In your work, instinct first or data first?
I think you're always intuitive. I think after motherhood, you learn to trust your instincts.
Section 3. Decoding baby skin from a dermat's lens. Do more products protect baby skin or disturb it?
Overlayering is bad for child skincare.
That strong oil massage before bath, right or wrong?
Wrong. Kids need calm, not strong.
I'll give you a few common problems. You just tell me the solution you'll recommend. Small red rashes on the skin.
Leave it alone. Don't use heavy moisturizers and use fragrance-free products.
Dry flaky skin. Diaper rash. Sudden redness on the face.
Sudden redness could sometimes just be flushing of the skin, and sometimes it could be a reaction.
Hi, I'm Rohan Rai, and this is Parent Brain Conversations. I'm not here to give you advice. Honestly, I'm here because I felt lost as a parent myself. There's just too much information out there, too much pressure, and no real guide. So instead of adding more noise, I just want to have simple, honest conversation with real parents. In this episode, I'm sitting down with my beautiful wife, Dr. Sonali Kohli, mother of our two beautiful children, and a professional dermatologist. I'm trying to understand her lens and how she balances all of this. And more importantly, how we can simplify baby skin and skincare for parents. Nothing complicated, just real experiences, real takeaways. Let's get into it. So Sonali, we are going to be doing 6 sections. We call the first section as Decode the Parent. Now I know, of course, what kind of a parent you are. I've spent 15 years with you. But this is more about the audience. Let's start with...
Yeah, I'm looking forward to this since we haven't ever done parenting questions, which are not arguments.
Of course, I mean, do you trust your instinct or quickly use Google or AI?
Earlier, maybe it was different, but after becoming a mom, it's always been instinct because that's something motherhood has taught me. That don't overlook your instinct. Usually you will always know in your gut if something is wrong or something needs immediate attention. But yeah, Google in some sense can be of help because it can help you understand the urgency of the situation.
In the moment, you react instantly or take a breath and then react?
I would love to say that I take a breath because that's what I always tell you to do. I think sometimes I end up reacting, but I'm making a conscious effort to step back and dissociate from the situation at that point and just breathe. This is what I'm trying to teach my husband, and that's what I'm trying to teach the kids as well.
No judgments in this at all. You're stricter than you think or softer than you admit to your kids and your husband?
I think you should answer that. But definitely, I think I'm softer than I portray. I appear much more strict, but I'm a big softie at heart.
I agree.
Think, yes, yeah. I think the boys will agree as well.
When they are crying, you go fix it immediately or wait a few seconds and see?
I think being a second time mom changed that for me. I think with the older one, with Vardhan, I've always jumped in, intervened. If there was a crying, I wanted to sort the situation immediately. But after the second one came along, I think the crying sessions were so much more that I've learned to step back and truly see if at that point I need to step in or let the boys handle it or allow the child to figure out what they're really crying about. So to help them develop a vocabulary for their needs. So stepping back sometimes helps. So I don't think it's ignorance. I think you just become a much more conscious and a smarter parent the second time
because
around.
I speak this because we had conversations where we thought we're ignoring the second one.
I agree.
And then we realized that no, it is not ignorance, but it is relearning and figuring out that this can be done in a better way.
Yeah, and also it gives you a breathing space, right? You also want to be more patient in your approach.
Rules you stick to or adjust depending on the situation?
So some rules are for me defined as boundaries, but I think more than all of it you have to be adaptable, which is what I'm learning as a parent. We both are that with kids there's no one chart flow. You have to adapt yourself. But some things are of course strictly boundaries in our house when it comes to how you speak to the staff, the kindness approach that you adopt, certain basic chores which they have to be a part of daily. I think that's where as couples, you can decide what your home situation is and what your boundaries are. But everything else with kids, you have to be adaptable.
When you say last time, do you actually mean it or there's a few last times?
With you, for sure, there are multiple last times. I think the boys as well. I would love to believe that my one last time was enough for you all, but no. There are multiple times I
Don't
have to
get
say
personal. Huh?
multiple times I have to say last time. Yeah.
Okay, screen time, controlled or it should be negotiated daily?
Honestly, I think it's very age appropriate. I think with both the boys, till a certain age, we were very strict, which meant no screen time.
3 years.
But post that,
2 to 3 years, of course.
About till 3 years. But I think post that, we have been aware of the fact that they will be exposed to screens. So the point is to teach them what is good enough and when to stop. I think shifting them to National Geographic, watching sports in general, whether it was seeing races or whether it was seeing swimming competitions, I think it has really helped us because the boys sort of started engaging in content which was more real and relatable. I just feel sometimes showing them animations can be challenging when they don't have the sense to realize that that doesn't exist in reality, especially because we have a dog. So if they were to see a cartoon like Paw Patrol, they don't expect our own pet to start talking.
Yeah.
So I think just showing them reality has helped us. But as I say, for every parent, the rule book is yours.
Between us, who do you think the child listens to more?
I don't think you should put up these questions.
I win.
I
Okay,
clearly think they
you win.
listen to me. Yes, clearly.
Sometimes they do. What do you think? Your parenting comes more from how you were raised or what you're trying to do differently?
No, I think it's a combination of both. I like to take pride in the fact that I think my parents got many things right with me. But along the journey, I'm also unlearning some things which didn't work for me, or let me say, which don't work in today's environment. There are things you have to unlearn because we grew up in a very different scenario. We grew up with very different tech. We grew up with very different exposures. So you have to adapt with time.
Do you feel that children need more protection and or some early exposure these days?
I think a lot of protection, but unfortunately protection can't be always taught. Sometimes it's important to let them understand exposure, to know what the safety boundaries are. But I think in the world that we're living, especially with the digital exposure available, I think it's very important to have your child understand what is safe and what is not safe. So those boundaries should be defined as an adult by us for them.
At the end of the day, you're raising a child to feel safe or to handle anything?
I think safety first for me as a parent, because as I said, you need to make them understand the good and bad of every situation, because the bad will always exist. So for me, it's always safety. I know you are more particular with protection, but as I said, it's very subjective, and I think it's always a mix of both which will help the child to holistically develop.
Yeah, and also I feel that at the end of the day, I mean, they have to know that there is a safety net at home, and that's the environment.
You always have to have your safe space. Even as adults, we need that. So a child needs it a lot more.
If you had to say you're a conscious parent or you're still figuring it out?
Always figuring it out. I think as a parent, you're just always figuring it out. There is no blue map, and it's actually tough for a person who's as structured as me to not have a blueprint going forward. But that's one thing motherhood teaches you. Every day is a learning.
And in the process in the last 5 years, of course, who did you seek help from in the process and the journey to figure this out today?
I think I should be very open about it. I have sought help at multiple times. And of course you will know that, but I'm happy to talk about it. I think before the younger one came in our lives, the first thing I did was to seek the help of a counselor to, one, navigate myself to be a parent to 2 children, and second, to ensure that I'm not giving undivided attention to one and try to be present for my partner and for the family. But I think I did do a course on to learn how to talk to children so that children listen, which is by Adele Faber, and I think it helped me a lot. It helped me a lot with Vardhan to navigate that whole sibling chapter in his life, because he was just 2 years.
I think that was a very challenging.
Just 2 years old.
Yeah.
And I think I did speak to a sleep consultant when the younger one came in, and we also had our nutritional consultant for weaning to help the children introduce into solids.
Those are those phases, right? You know,
yeah,
you have
I think I've always sought help, because you can't know it all. So you go to somebody who has more experience than you in that particular chapter if you need hand holding. And I think that's why they say that it takes a village to raise a child, because you actually need that many people. But for us, when we live in nuclear families, sometimes only the ancient wisdom nuggets are not enough. You need someone to hold your hand.
But today it's become a little challenging in terms of a lot of people don't have help, or don't have a village to actually raise, and people are working, and both parents are working, so it gets very challenging for people to actually, raise a child. And in the process, I feel parents lose their sanity. And what do you think a couple can do to navigate these situations when a child is growing?
Yeah.
Now, we have 2 children, but there are people who are with 1 children also, both families working. What do you think can help them, or how can they maneuver this and figure this out?
So honestly, as I said before, I'm no parenting expert. I can only talk from our experiences. But with the older one, I had postpartum depression. The challenge really came to first accept what you're suffering, second to communicate, and then third ask for help. I clearly asked you for help. I told you I can't do this, and I need for you to step in, which you did. And I think we need to stop pretending that we are all wearing this cape of womanhood where one person can just do it all. Nobody can do it all, and I think each one is bringing their whole heart into everything they do, and you're doing justice in whatever manner you can. And I think acceptance of that rather than perfection is the only thing that has helped me survive with the boys, with the brand, with doing justice to my patients, doing justice in whatever manner I can to you, which you always complain that you are least on my priority even while numbering. But yeah, you do what you do.
But does that happen? Does your partner go on last number when you have a child and when you have a family in general?
Honestly, I don't think it happens for everyone.
I mean, I know it's not a chosen path for everybody.
Yeah, I don't.
But it just so happens because you are going through postpartum once you have a child, and then you have to take care of the child. Then you have to, the child's needs, and then your own needs, and then. So I think it naturally happens.
I think it's very difficult, and as I said, there is no perfect balance, but I think you learn along the journey.
Yeah.
And I think that's what you and me are also trying.
Yeah, for sure.
There are days when you're very balanced, and then there are days when you're completely out of balance.
Yeah.
But I think that's what parenting is, right? Like you're trying your best.
You're perpetual students of life.
Yeah, 100%.
So now we go to section 2, which is decoding you as the professional. In your work, instinct first or data first?
I think if you asked me this like 3-4 years back, I would have said 100% data. You know how geeky I am and how much I rely on research. But that's something that's changed a lot for me. Now it's a lot to do with instinct. Also over the years, my practice has changed. I'm seeing a lot more children. And now I see, when I look at a parent, I also see what my instinct is telling me. What could be really going wrong? Is it lack of sleep? Is it cortisol? Is it poor diet, especially with kids? That could be causing the problem. And that's how I, sort of incorporate my data and treat the child or treat the parent.
But where did this instinct, how did this switch happen? Because of motherhood or what?
I think it's both.
You become more intuitive and...
I think you're always intuitive. I think after motherhood, you learn to trust your instinct. I think that's what changes a lot as a parent, and I'm sure it changes for every person, not only as a mother, even as a father, but you learn to trust your instinct. Like that this might happen, you just know it in your gut. And I think sometimes when your kid is unwell, you know that these loose motions will stop and these need attention, but that's your first instinct. So now I've learned to rely on that a lot, and I've learned to not overlook when a parent comes to me that concerned, whether it's a mosquito bite, whether it's just redness on the child's face. I think previously maybe I would have felt like, it's just redness, it'll go. But now I get it. I understand why that concern is coming. I understand what that parent could be feeling and what that anxiety is causing for that parent. And that's what has really changed my practice.
But do you think parents become very hyper in this process?
Yeah.
Can intuition and instinct be,
No, I don't think it's your intuition and instinct which makes you hyper. It's I wouldn't say lack of knowledge. It's the lack of right knowledge and overexposure to excessive data which scares you. And I think you are a hyper parent as well. For everything the children go through, I think...
as a father, I feel like, father to 2 boys, my hyperness comes from when they are probably out playing, and I feel like,
you overreact to cuts and to wounds, but as I said...
Yeah, I get scared.
But that's what I said, that's what I'm learning. I'm learning not to categorize or judge you as a doctor and truly understand where it's coming from, because it's coming from instinct, and maybe it's not right on my part to overlook your instinct, because you're the parent and you might actually know something's wrong with your child.
Are you more cautious or are you more decisive?
I've become a lot more decisive. A lot more. This is professional questions we are talking about. I'm a lot more decisive.
No judgments, no judgments. Oh shit.
I'm a lot more decisive in my professional approach. Genuinely, I think it has come from that fact that as a parent, you don't need more confusion. There's just a lot of confusion already and a lot of noise out there. What you need from a professional is clarity.
How can parents cut noise? Do you become more self-aware and then you become, I believe you can't just become self-aware overnight, right? In my case, I believe that, I did a lot of self-awareness exercises over a period of 2-3 years after fatherhood, and I think a lot of things helped me in that process. And of course, thanks to you,
I take all the credit.
I mean, see, I can talk about our case where I was open about learning, which happened over a time. I was very rigid, and it was changing over a period of time. But I believe, what can parents do? I mean, this is from our experiences that we can say that this is what we did.
Yeah.
So what is a couple of things that I believe parents can do from your lived experiences that, cut out these noises? Like, you would have seen on, like you mentioned, on mother groups randomly, people have put things, and you get 10 advices, which is probably wrong. Or, you're looking at certain people talking on social media, which is not their forte. So, like, do you think that parents should cut it out completely and stick to professional advices, or what do they do?
No, I think the only thing that truly I would say as a professional is that it's okay to absorb information, but it's not okay to administer that information without having the right guidance. So you absorb what you need to learn and go question a professional about it, because they are the ones who can truly guide you. Simple things like whether you should be applying breast milk, or you should be applying haldi at home, or you should be using which oil. Listen to what people are suggesting, but don't go and try everything on that child. The child's skin is not ready for it. So you absorb it, then have somebody guide you with that what will truly work. Similarly, for any cold cough infection, I think, as parents in the beginning, nobody wants to medicate. We've had that your elders guide you, that use garlic on the chest, put onion next to the child's head. It's not that I have not heard those advices, and at some point I think as a first parent maybe I also did incorporate some of it, but the reality is that if your child is going to react with the garlic touching to your skin or rubbing onion juice on your feet, then that's not something you can do. So this is where you tweak, and we have the ability to reach out to professionals, take guidance, and you have tools. AI has made life easier. You have so much data available. So the question is to really understand that I'm listening. I don't necessarily have to make it a part of my routine.
Correct. I mean, of course, we use a lot of AI today, but having said that, it can't change lived experiences. AI can't give you that. So I think you can use AI also, you can absorb things from that, but of course at the same time,
it's what I said, you gather the information, but you structure that information in your brain with the help of these tools, but then you seek guidance from a professional for that same thing.
I mean, with patients, are you more reassuring, or are you more direct now?
I think most of my patients will feel I am very direct, because honestly I just don't like to sugarcoat it, because as a parent, when I have gone to a doctor, I always wanted the truth, because it just gives you more peace, and I think that's the approach I'm using with my patients. You need simplicity, you need clarity, and you need actually doable actions, and that's what I've learned as a mom. These three things, and you feel a lot more calmer in your head. So I'm trying to do that for parents. I'm trying to make their life as simple, give them simple doable routines for their child, and just bring them clarity of why I'm recommending what I'm recommending.
I think consistency is something which people require, parents in
I
general require.
Us, with kids
whether
and
it could be
elders.
routines, or it could be child skincare, or it could be, I mean, I could talk about child skincare because of our brand, but I'm saying it could be just consistent care. It's just basic routines for kids in every aspect.
So honestly, I think we all know that discipline in routine helps you, right? In life, as an adult as well. In a child, especially under the age of 2 or 3, discipline in skincare looks like consistency. So there is no confusion of why that should exist.
Do you explain everything in detail, or keep it simple to the point? I think it's the later part with me, but otherwise.
No, I think I've, as I said, being the geeky person that I've been, I've always gone into a lot of detail, but I'm really restructuring, because I think when someone comes to you now, I ask myself, what does this parent really need to hear? And is this parent feeling assured by the information I'm sharing? Because sometimes oversharing of information doesn't give you reassurance, it gives you anxiety. And that's something I've learned over time with my practice, and which I think as a doctor sometimes we can overlook, because certain information is coming to our brain very naturally. Me sharing that could give you a lot of anxiety rather than reassurance. So now I'm trying to be a lot more direct, share only what's needed, and as I said, keeping it simple with clarity.
Do you rely more on experience or updated research?
Both. See, medicine is evolving, and so is motherhood. You can't use one tool. It has to be both. The question is that you be adaptable and open to both. You can't deny that technology is advancing. The easiest way is adopt it in your medicine and make it better.
You see your role as fixing problems or preventing them?
Preventing. I don't think. I would love it if I could be a fixer to all problems, but the reality of being a doctor and the reality of being a mother is you can't fix everything. You can only try and prevent as much as you can, and you do your best. as a doctor and as a mom.
Are you more perfection driven or outcome driven?
I think now for me it's just always outcome. There was a period in my life where it was only perfection, and I think all you, my family, everyone who's been close to me explained to me how detrimental it could be for my children's upbringing, and I think it's a decision I took before the kids came into my life. I've really tried to just sort of serve the outcome. So now in my profession, my outcome is the parent reassured and is the child feeling better? And that's about it. I might not treat the child's skin in 7 days that you come to me, but you'll know that I'm the person who's going to be there even after 1 month if your kid is not feeling better, to hold you through it, you know. So I think it's that, and that's what I needed as a mom, and that's what I'm trying to incorporate in my practice to be able to offer that in my scope of service.
Most important question. Do you switch off after work or your mind is
I
still
don't want
in
to answer that.
it?
I think you give me a lot of grief for that. I would love to switch off. I try my best to switch off, but you know, some conversations stay, some patients stay, some children stay with you. It's what it is. But when I come home to my boys, I try to be there, and I've always said this to you. I come with my whole heart and I do my best. And in those little eyes, I'm perfect. And I think that's all. That's the only perfection I want. That's the only perfection I'm seeking.
I think
right
also
now.
it's not about quantum, right? You don't have to spend the entire day to just be there. Even if that 10 minutes that you come from office and you just give that 10 minutes, half an hour, 20 minutes, and if it's given fully to them, I think that's what stays.
True.
That, you know, I believe underrated CEOs are mothers, and I believe that you guys, I mean, women have generally taken upon a lot. I can tell with your experience that you used to be very guilty about it.
It's what I said, right? You have to give up this tone that we preach to ourselves, that we have to be perfect, we have to be good at everything, we have to balance it all. We don't.
I think it's
just do what you do, and you do your best. Yeah, and it's what you just always show up in your best manner. And some days will be good and some days will be bad, but that's life, right? And your kids need to see that.
Yeah.
You are not always going to smile. You will cry, you will feel sad, you will feel lost. And they will feel those emotions too. So what's the point showing them a picture which is never going to add that I'm an expressive parent? Let's put it like that.
Yeah.
So yeah, I cry when I have to cry and I laugh when I have to laugh. But I think there's no harm in that. I don't see why my kids should not see all versions of me.
It's not like I haven't cried. I've cried myself. So I think I cried when I did the second birthday video, first birthday video when
I was pregnant.
I cried a lot.
Yeah.
While I was talking, I was like, what is happening? Suddenly, you know, kids. So we did a video, you know, out of context, but second birthday gift. We did a video of Dada, Dadi, Nana, Nani, us, and all of the family, which the kid will see
when he's 18.
When he's 18, and I think everyone should do that. Everyone should do that exercise where you just take a video of the entire family talking to the child. That, you know, because you don't know 18 years from today where their Dada, Dadi, or Nana, Nani, or for that matter, parents will be. But it's an 18th birthday gift that we gave to our child, where we are speaking to them as a second birthday gift to them. It was friends, family, and I really cried.
Yeah.
And I couldn't control my tears, and I was like, shit.
True.
Now let's talk about section 3. Section 3 is basically decoding skin, baby skin issues from a dermat's lens, keeping it short and sweet.
That.
So understanding the foundation of the skin, which is your favorite topic, and I've done a 2-hour lecture on this couple of times.
I will try and keep it brief, I promise.
Yeah. So is baby skin thinner or thicker than adult skin?
Thinner, 20 to 30% thinner, and that's why it absorbs a lot more, loses moisture much faster, and is much more reactive. As I said, because it's almost 20 to 30% thinner, there's something known as the transepidermal water loss. Now that is much higher in baby skin, so it's actually getting drier even though it looks soft and supple.
Is baby skin actually more sensitive or just looks soft?
No, I know it looks super soft and snuggly, but it's extremely sensitive because of a thinner barrier. So everything can react a lot more in a child's skin. So that's why you need to protect it. And this is why I say the baby skin care is actually the foundation. This is why I say it's the foundation, because the child's skin is still developing.
So the first 1,000 days of the child's life is very important.
Very, very important for developing skin.
Do more products protect baby skin or disturb it?
Disturb. Overlayering is bad for child skin care.
Is daily oiling necessary for every baby, or does it depend?
Majorly depends. Oiling is a traditional ritual very prevalent in India, and yes, oiling can help because it helps to retain moisture. But what is important to understand is when you use traditional oils, you use that much soap to wash off that oil. And that's what's exposing your child's skin to become weaker and lose that much moisture. So choosing the right oils, preferring bath oils, understanding which oil is suitable for your child's skin is absolutely mandatory before you get into this ritual of oiling every day.
Is simple minimal care better or a full routine better?
No, No, so routine can be simple. So 100% your child needs a skincare routine, but the skincare routine needs to be simplified and absolutely basic. Minimum 2 products, no over layering, no over lathering, and consistency. Consistency to skincare is the tool to get a healthy foundation for the skin.
Okay, now this is where it gets interesting, because a lot of what we do as parents isn't always based on understanding. It's based on what we've seen growing up. These are habits that almost every Indian household follows without really questioning them. It's called right or wrong. That strong oil massage before bath, right or wrong?
Wrong. Kids need calm, not strong.
Hot water bath right after massage.
Wrong. Hot water always dries your skin further.
Using more focus during massage, thinking it helps growth.
No. Massage doesn't help growth, nutrition and sleep does.
Applying oil and leaving it on for long before bath.
Honestly, depends on the child's skin and the oil you use, but in general, wrong.
Rubbing the baby's skin while bathing to clean properly.
Wrong. Baby skin does not need scrubbing, it's too gentle and the barrier is not developed.
Using the same routine every single day without checking the skin.
Wrong. Consistency is important, but also understanding what your child's skin needs is way more important.
Applying Kajal assuming it's safe for babies.
Wrong. Kajal is sensitizing and an allergen for the kids.
It's also Kajal is also put for nazar, so.
Yeah, but of course with organic and sourcing things can be different, but as a dermatologist I do not recommend it.
Using home remedies like Haldi or besan on baby skin.
Wrong. Kids' skin does not need scrubbing, their barrier is not developed, skin is too thin.
Over covering babies to protect them from weather.
If you live in a tropical city like Mumbai, not at all, because the humidity is too high, so overlayering actually adds to moisture. Even in colder weathers we tend to think that children need more lathering because they feel colder. But actually over lathering of clothes with layers can actually cause more skin problems than help.
Thinking redness or peeling always means something is wrong.
No, it's not always wrong, yes, but if it's persistent, take guidance. With skin care, with children especially, it's not always disease driven.
Section 5, wherein what to do. It's called what to do. I'll give you a few common problems. You just tell me the solution you'll recommend.
Yeah.
But as a dermat, what you think about these? Small red rashes on the skin.
If it's appearing, especially with weather change, it could just be something as milia. Leave it alone. Don't use heavy moisturizers and use fragrance-free products.
Dry flaky skin.
Could be lack of moisture, impaired skin barrier. Preferably use oiling or oil baths, and make sure that you are using balms over lotions, because the skin might need a heavier consistency cream to lock in that moisture.
Diaper rash.
Diaper rash occurs not only because of excessive moisture, but sometimes it's actually when the child's skin is in contact with the urine and the stool. So what becomes really important is giving a zinc oxide paste after every diaper change and giving enough diaper free time. That is what is essential to prevent diaper rashes.
Are there zinc oxide paste readily available? Is there more?
There are multiple brands which are available. There's Pseudo Cream, there's Desitin, there's Aquaphor paste. These are all pure zinc oxide bases, but zinc oxide helps to develop the barrier of the skin, especially in these areas, to prevent that diaper rash to occur.
Sudden redness on the face.
Sudden redness could sometimes just be flushing of the skin, and sometimes it could be a reaction to something that the child has applied. So ensure that you check the products that you are using. Always stick to fragrance free. Fragrance is a big skin irritant for kids.
Heat rashes in this weather.
Leave them alone. Stop oiling and stop moisturizing the skin for some time. Use plain water for washing the skin.
And nothing at all.
You can use clean moisturizers which are lotion based, not heavy duty creams, but definitely no oils. And these products, when they are used when the rashes are active, have to be paraben and free of any kind of fragrance, because that's irritant for the child's skin.
So there are these wipes which parents use to clean.
So only 99% water wipes are okay, but anything that contains even a little bit of additional fragrance can actually be harmful at such a time.
Like an essential oil fragrance or anything. No, nothing is allowed.
Everything organic doesn't mean that it is safe. It's important to understand that. Sometimes it's okay to use scientific things, but as long as they're tested and known to help the skin condition, that is much more important to use than using an organic product without understanding it.
I mean, I have a list of questions, but just to understand, when you say this list of organic, how does this work? Science-backed products and versus organic products in baby care?
So in my eyes, honestly, there's nothing versus. It's really what works for your skincare, for your child, and to understand that skincare is never one rule fits all. You have to see what's working for your child's skin. So if an organic product is working for a particular child, but irritating your child, it could be that your child is eczema prone. Maybe your child has a tendency for atopy. They could react to these products. So even if you're using essential oils, just because they're organic doesn't mean they're not irritant. something even containing a tea tree oil, simple oils could be irritant on a child's skin. So it's important to understand what works for your child's skin. Having said that, everything that is scientifically formulated is not necessarily bad. These formulations go through testing to understand what is truly safe. So what is important to understand the ingredient percentages that are in the safety standards for your child's skincare.
Repeated irritation or sensitivity.
You have to definitely look into what you're doing. Whether you're using excessive products, you need to minimize. If you're doing over lathering, that has to stop. You have to ensure your products are free of any kind of fragrances which could be irritating this child's skin. And if all of that is ruled out, sometimes it could be an early food allergy which is setting in. So discussing it with your doctor becomes important.
White patches or dry spots appearing suddenly.
Usually they are normal. The child's skin color takes time to develop its actual shade because of the melanin. So a lot of times it's just the different types of sun exposure, but sometimes it's an indicator of deficiency, and sometimes it's something known as pityriasis alba. However, it's not alarming and doesn't need absolutely immediate attention, and not all hypopigmented spots are indicators of vitiligo. Having said that, follow your instinct. If you think it's something that's bothering you, have an expert look at it so that you can put yourself to ease.
Tiny bumps on cheeks or arms.
Tiny bumps on cheeks or arms could, in the newborn stage, could actually be nothing, just neonatal acne, and they need no action. Using plain water, sticking to minimum skincare routine is what helps. However, if they are persistent, sometimes it could be a fungal rash which will need treatment. So for that you need a dermat's opinion.
Redness around the mouth or chin area.
If your child is drooling, most usually it's because of that. Using ointments like Aquaphor, which are basically more ointment based, can help you trap the moisture and prevent that excessive dryness. Don't use wipes to clean your child's mouth repeatedly. That actually causes excessive dryness. Just dabbing with muslin cloth can actually help, or using plain water to wash and then applying the ointment base.
Baby scratching or rubbing the skin often.
First thing, trim the baby's nails so that you don't infect those scratches. That's the first priority. Second is to understand that whatever skincare you're doing might not be providing the necessary barrier that the child's skin needs. Maybe the child needs a much more heavy based balm over using a regular cream or lotion. So identifying that becomes important. Secondly, it could be that you're using excessively warm water for the child's baths, that is drying the child's skin, or the child is constantly in an air conditioned environment where it needs a humidifier. Sometimes it's just the simple tweaks that actually go the long way. Setting the foundation of the child doesn't have to be complicated. It can be really simple. The point is to understand the trigger and eliminate it.
Sweaty skin leading to small breakouts.
Gentle clothing, don't overlayer, and make sure you don't use heavy products during the day if the child is out and about and playing in the mud. At that time, using creams or lotions is always preferable over using balms.
Skin reacting after trying a new product.
Always test patch your product at an area for the child. Leave it on for 24 hours to understand. You can use the inner part of your elbow or behind the ear. If the child is reacting to any ingredient in that product, you will know instantly.
So you leave it for 24 hours.
Yeah, you apply it and you leave it when the child sleeps at night. Usually you will see a reaction in the morning, or you apply it during the day and leave it on. So you will be able to tell.
Uneven skin tone or patchy skin.
As I said, the kids are still developing their skin up to 2 to 3 years of age. Their melanin, which is your pigment producing cell, is still getting distributed. They will start spending a lot more time in the sun. So usually it's just tanning and nothing to worry about.
Come to section 6. So let's keep this simple and clear a few things up. So myth versus fact. During pregnancy, should you actually be eating for two?
Myth, you just eat for yourself.
Does eating more food automatically mean a healthier baby?
No. When you are eating, of course your child in the womb is getting exposed to flavors, but it's important to have a balanced diet.
Whenever you have cravings, should you always follow them?
No. We've all believed that we've had cravings, but honestly, after having studied functional medicine, I truly understand that the cravings could be a sign that you're just consuming less protein, and that's why your body is asking for sugar.
Is having ghee every day during pregnancy really necessary?
Not at all. Having no kind of one food is necessary every day.
Do sweet foods during pregnancy affect what the baby prefers later?
As I said before, in the womb, the baby is getting exposed to flavors, but eating sugar is in general not good. It's causing insulin spikes, and insulin spikes are not favorable for anyone's health.
Part 2 of this versus that.
Okay.
When it comes to pregnancy nutrition, what matters more, quality of food or quantity?
Always quality.
Is it better to rely on home cooked meals or supplements?
Home cooked meals. Having said that, supplements can be beneficial, but they don't replace food.
Should the diet be very strict or more balanced and flexible?
For me, strict means more stress. Balance means sustainability. So always a more balanced diet, something that you can sustain on.
Natural foods or packaged nutrition products, what's better?
Natural food.
Quick picks. For overall nutrition, what matters more, protein or carbs?
Balance. Protein, carbs and good fats.
For daily intake, fruits or packaged juices?
Fruits, always eat the whole thing.
For snacking, whole foods or processed snacks?
Whole foods. You'll always get much more nutrition from it.
For iron, food sources or supplements?
Food sources. Having said that, if there is a deficiency, you have to supplement because there could be an issue that you're not absorbing iron, and in that manner, you need supplements.
Right or wrong habits? If someone skips meals because of nausea, is that okay or not?
I think it's honestly very subjective, but in general, no, because the increased gap will actually cause a more acid reflux. So it's always better to eat small portions, but if there is an issue with the digestion, you should always take the opinion of an expert.
When cravings hit, is overeating okay or not?
No, balance is more important to settle your cravings.
Taking supplements without checking, is that okay or not?
Not at all okay, extremely harmful.
Depending only on diet without supplements, is that okay or not?
In my opinion, in today's day, the food is too processed, so you will need some amount of supplement to support a healthy diet. But if your levels all seem okay and you feel that you're fit, continuing on a healthy diet is a manageable option.
Super. So interesting how all this connects, because we've started understanding you as a parent, instincts, reactions, the small everyday decisions. Then we saw how you think as a professional, structured but still human. And what's really stood out in this is, even with all this information, all the awareness, parenting still comes down to simplicity.
True.
And structure and consistency.
And then learning, in all honesty.
Yeah. Like I say, we are perpetual students of life. Understanding over overthinking, and consistency over excess.
Yes, always.
And knowing when to step in and when to step back.
I think stepping in, we all know, it's just about understanding when to step back.
But before we wrap, I want to step back for a second and ask you just 3 to 4 questions every parent should ask themselves. 1. Do you think parents today are being too hard on themselves?
I don't think I can speak for parents. I can definitely speak for myself. I think I'm a little too hard on myself. There are days when I want to be present, I want to be happy, I want to smile, but I've had a bad day. I'm distracted, I'm thinking about something else, my mind is all over the place. But I'm learning to step back, be in the moment and be grateful for the fact that I'm at least being there in whatever manner, but being true. And I think that's what it's all about. It's not always about being the perfect smiling parent. It's okay if you're not feeling good, but you're showing up, and that's what it is, just consistently showing up.
Do you think children today are being prepared for life or being prepared to fit in?
I don't know. Sometimes I think we all give in to that pressure and you do try to fit in. And I think that's where conscious parenting comes in, where you try your best to teach them to be comfortable in who they are. I've had moments when I've said, oh, don't do this properly, sit like this, don't behave like this. But you have to correct yourself and you have to teach them boundaries, but you also have to allow them to be themselves and be secure about who they really are. And I think I learned that a lot with my younger one.
Or did you learn it with your husband?
Having said that, clearly.
Where do you think we are crossing a line as parents today without even realizing it?
I think we are overprotecting, sometimes oversharing, and sometimes being overly cautious. And I think that can sometimes take away a big part of your childhood. So we need to step back and allow the kids to experience some failures and of course a lot of joys. But we have to accept that pains and failures and learnings are something that's so integrated that you can't separate them. But when you're so overly informed, I think we try to separate them and sort of hope that we can protect them from everything bad.
Yeah, I mean, there are so many other things we've spoken about, sometimes just let them be at home and do nothing. Let them just sit at home and,
Like we don't want to allow them to feel bored, We feel like they need constant entertainment. We feel they need constant engagement. And I think sometimes it's the problem of our generation because we have so many opportunities and we have so much knowledge and so much information. I think that's where you need to unwind and allow yourself to be and just allow them to be also, because if we are less stressed, that translates into the environment of the house.
Also, I mean, it's mimetic desire is, where you just see and ape things and copy things. Sorry guys, I wanted to put in something.
Mimetic desire, oh my god, I'm never going to forget that. I couldn't control it.
My next post was on mimetic desire.